understand. You've been having some abdominal pain? Yeah, it started as a dull ache around my belly button yesterday. I thought it would go away, but today it moved to the lower right side and is sharp. It hurts to work, even when I breathe deeply. I see. That sounds quite uncomfortable. Any nausea, vomiting, fever, or loss of appetite? Yeah, all of the above actually. Based on what you've told me, we are going to check for something called appendicitis. It's one of the most common causes of sudden abdominal pain. Appendicitis? I've heard of it, but I thought it only happens to kids. Appendicitis usually affects young people aged 10 to 20 years, but can happen at any age. It happens when the appendix, a small pouch attached to your large intestine, becomes inflamed, often due to blockage of stool, infections, or even trauma. What happens if it isn't treated? If untreated, the appendix can rupture, spreading infection through your abdomen. That's called peritonitis and is very serious. That's why early diagnosis and treatments are so important. Is surgery always necessary? Treatments is normally surgery and appendectomy to remove an inflamed appendix before it's burst. If you are very unwell, your surgeon may operate straight away rather than ordering more tests. If you don't need surgery urgently, you may be given antibiotics and observed for a time. What happens after surgery? Is recovery hard? Once you've been discharged from the hospital after your surgery, you need to keep the site of the surgery clean, wash it daily with gentle salt and water. Often 48 hours after the surgery, the dressing can be removed. You may have dissolvable stitches or regular stitches that need to be removed at a later stage. Check with your doctors on this. Drink plenty of fluids and eat more fiber, as you may have constipations for a short period after your surgery. Attend follow-ups, usually 10 to 14 days after your surgery. Limit your activity. Do not do any heavy lifting or strenuous activity until you have been seen at your checkup appointment. Manage your pain. In most cases, pain felt after surgery should be minimal after the first few days. Take the pain relief medicine as prescribed if required. That was so helpful. Follow Celine the nurse to learn more about your health.